Grant is one of thousands of Minnesota teenagers each year who have wisdom teeth removed. His pain management plan following the surgery aligns with the opioid prescribing guidelines, created in part by the Minnesota Department of Health to address the growing opioid epidemic.
I was numb up until I went to bed, and I had taken an ibuprofen and a Tylenol before I went to bed, just in case I did experience some pain. And the next day when I woke up, I'm going to be honest with you, I didn't really feel too much pain. It was just kind of like achy, but I don't think it was anything needed for any stronger drugs or anything.
Partnership for Drug-Free Kids cited a study that found teens who fill an opioid prescription after wisdom teeth removal are almost 3 times as likely to use opioids persistently compared with peers who don't fill their prescription.
We as dentists want to manage their pain. We want to take care of our patients. And sometimes then we'll prescribe an opioid to manage their pain. The trouble is, at the teenage years, their brain is not fully developed. The judgment center is not developed until they're about 25 years old. So it's really not a very good time for us to be prescribing these highly addictive drugs.
It used to be a practice that we would send patients home with opioids, and we really don't do that often at all anymore.
Dr. John Reardon is one of more than 3,000 Minnesota dentists who support opioid prescribing guidelines.
We expect to have some pain. We expect to have some discomfort, and we aren't trying to get rid of it and have them feel nothing. We know that they're going to have some, and we know that it's manageable in general with ibuprofen and acetaminophen.
Dentists should be aware that there are other ways to manage pain. We need to work on pain management, not pain elimination. If we work for pain elimination, we're giving too many opioids at too high of a dose. If everyone has a uniform voice, we all are fighting this opioid crisis, we all know it's a crisis, and we all need to recognize what is our role and how can we work to alleviate this problem.
And Grant is just one example of the guidelines reaching the right teenager at the right time.